Hello all, this is Michael Van Porfleet with Mend Physical Therapy. Just want to take a moment to demonstrate and walk through the cervical manipulation and just certain things that you can be cueing in on to help boost your success level for this technique. So you'll have your patient lying on the table, and these are for patients that you've stratified into a mobility category where they have some sort of mobility deficit in their facet joints. For Libby particularly, we know that she has a mobility deficit in more C3, C4. And the way I do this and the way I diagnose this is through pivums and pavums back and forth on the articular pillars. Her specifically is more on the right side, C3, C4. I will approach the table at a diagonal angle, stagger stance with one leg back. My anterior lateral aspect of my second digit is on her articular pillar. Her head is rotated 30 degrees contralateral to the segment that I'm targeting. There's a 30-degree side bend side shift, and depending on the level of the segment, either 2 degrees extension or 2 degrees flexion. So for Libby, I'm hitting the articular pillar of C3, C4, rotating 45 degrees, 30 degrees side bend side shift with a few primes and a quick pronation of your short arm applicator and supination of your long arm applicator. And since we know this is a bilateral event, I do want to make sure that I address both sides. Thank you.